Women's ability to access healthcare is a growing concern, particularly in South Africa, in the wake of what we're seeing as increasing reports of gender-based violence. This was one of the leading discussions at the 19th annual conference of the Board of Healthcare Funders of Southern Africa at Sun City in the Northwest Province. Local and international researchers have highlighted growing concerns around women's access to healthcare, sexual harassment in the workplace, as well as their space in health leadership positions. Well, for more on that story, we're now joined by our reporter, Sintleheng Lihihi, who's there at the conference. Thanks so much for joining us. Tell us a little bit more about what's being discussed at this conference and who's there.
Good afternoon to you and our viewers. It's the second day of the 19th annual Board of Healthcare Funders of Southern Africa conference. We have had many talk about universal healthcare and the different opportunities and challenges there. We have heard from women speaking about what they want this national health insurance to do for them as industry players and as consumers of healthcare products. And we've also heard from key industry players within the private sector who've shared their insights about the opportunities as well as the challenges that need to be countered to ensure that universal healthcare achieves exactly what it needs to achieve. Besides me, I'm joined by my great prof, in fact. Prof, coming as a representative of doctors across the country, tell us, where do the private sector stand with regards to the NHI?
I think this conference has demonstrated clearly that the private sector supports universal healthcare in totality. We support that it should be universality and there must be social security. We also believe that every citizen has a right to healthcare, and it is a time we did this. But we see challenges, and the challenges we see is, are we ready to implement universal healthcare to the entire country immediately? And the challenges that we're concerned about are, one, do we have enough human resources, support services, our facilities enough to provide these services? Do we have to look at the disproportion in terms of the distribution of resources? And what we feel is, and the message that's come out loudly in this conference, is that we need to have a very progressive universal healthcare implementation. It's an iterative process. It must be pro-poor. It must care for the indigent. It must care for the vulnerable populations. And then in a slow process we do it. So the message in this conference is that universal healthcare is a journey. It's not a destination. And we want to be part of the solution, and we want to be part of their journey.
In this very note, there will be major changes that will come with our regulations. This is where you come in, Dr. Mini, coming from the medical aid schemes. How do you feel about the impending changes that we're soon to hear about?
First of all, we accept that we will only know on Thursday, that is 2 days from now, exactly what the two amendment bills introduce going forward. Because we've had, for instance, the National Health Insurance White Paper. There's an amendment that is coming through. We've had a Medical Schemes Act that has been there from 1998. We're seeing an amendment on Thursday as well. So we want to give that process enough time because, as you understand, these are bills. And bills in their nature is documents that are going to be open up for all of us to discuss and interrogate and accept what makes sense and suggest changes where we're not happy.
And what would your suggestions be coming from the medical aid scheme?
From the medical aid regulator of the medical schemes, we have our own area of interest. We want to make sure that as the regulator of medical schemes, all the expertise that in medical schemes should be made available to the Minister of Health to make sure that he starts off with the experience that is there already instead of starting from scratch. That is our approach. As Professor Chetty said, we in the private healthcare sector support the introduction of NHI. We're going to look at the amendments, we're going to engage with them, we're going to tell the minister where we're not happy, where we're happy, and we as a regulator, we're going to make sure that we bring all the support that we get from the industry to the side of the minister to make sure that the country experiences, shares in the experiences of the private healthcare sector.
Absolutely. With these types of insights coming from our private sector representatives, it's clear that these are interesting times in the health sector of South Africa until we see the national health insurance really satisfy everybody. We hope that all of the private stakeholders, including their government counterparts, will get synergy and ensure that everybody benefits. Back to you guys in studio.
St. Thank you very much indeed. Very important issues being discussed there, and one story will continue to keep all over for you.